Namaste, I am Dr. Vishnu Charan working at SRI KARI Ayurveda CLINIC, Madanapalli. After a very long time we are making videos again. It is because of our hectic schedule and some other reasons we were not able to do videos. From here onwards we will be doing videos regularly for public awareness of Ayurveda and for the education purpose of the Ayurvedic knowledge. Today in this video we are going to learn about a fantastic Ayurvedic procedure called Netra Tarpanam. Netra Tarpanam is a Netra Kriya Kalpa which is explained in all Ayurvedic texts. Vagbhatacharya in Ashtanga Hridaya Sutra Sthana, he precisely explained the procedure, indications and benefits of Tarpana procedure in Sutra Sthana. Now I will explain you about the main indications and the method of Tarpana as per Ashtanga Hridaya. Nayane tamyati stabde shushke rukshe abhighatite vatapittature jihne shirna pakshmavilekshane kruchronmela shiraharsha shirotpata tamorjunaihi syanta manda anyato vata vataparyaya shukrakaihi ature shantaragasru shula samramba dushike nivate tarpanam yodyam shuddhayor murdakayayoho kale sadarane sayamcha uttana shayinaha. So it was explained that Tarpana is a procedure which is indicated in the conditions of Vata Pitta Pradhana, and also he explains that Ature Shantaraga Shru Shula Samramba Dushike means a person in any eye disease, first all the inflammatory symptoms of the eye like reddishness, watering and all the symptoms after getting down, then that patient can be subjected for Tarpana. So this is in diseased condition. For a healthy person, he can take Tarpana procedure directly. Tarpana procedure is highly indicated in clinical conditions of high myopia, diabetic retinopathy, uveitis and also in panuveitis, glaucoma, branch retinal artery occlusion, branch venous occlusion, central retinal artery and venous occlusions, cystoid macular edema, keratitis and in ptosis. In all these clinical conditions and also in other major clinical conditions related to degeneration, Tarpana can be advised with different medicine combinations. Tarpana is a procedure in which a wall is constructed around the orbit of eye with a Pali. Pali is a thing, a round strong wall which is made out of dough. Acharya explains that Yavamasha Mayim Palim Netra Koshat Bahissamaha Dvayangulocham Drudam Krutva Yataswam Siddhamavapet Sarpir Nimilite Netre Taptambu Previlapitam Naktanya Vatatimira Kritra Bodadike Vasam A Pakshmagrat. Acharya says that Yavamasha Mayi Pali, the dough or the flour which is prepared of the flours of Yava and Masha is to be mixed well and it is to be made in the shape of Pali. Pali is a round strong wall which can be attached to the wall of the orbit. Then after attaching firmly, the medicine either ghee or vasa which is taptambu previlapitam, which is made warm indirectly by dipping it in hot water, then again bringing it back to room temperature, is to be installed in the eye and it is to be retained. Then the patient has to blink continuously as per his clinical condition. Now I am going to show you the method of mixing dough and how to make Pali.
Flour taken in a container
is to be mixed gently with hot water until it gets semi-solid paste consistency. It should not be neither too hot nor too loose. It should be in a consistency of sticky nature that it will get attached to the orbit of the eye. As shown in this video, it should be made gently until it gets semi-solid paste consistency. 50 ml of medicated ghee which is made warm and got back to the room temperature, sterile cotton balls, 2 cotton pads and a gauze roll, 2 polys of 2 inches height which is made out of the dough already prepared, and a small dough ball for cross fixation, malati flowers for bandaging. So the complete set of material required for performing Tarpanam are medicated ghee, 2 polys, cotton balls to drain the medicated ghee, malati flowers, sterile cotton pads and gauze roll for bandaging. Now I am going to present you the practical demonstration of Tarpanam procedures which we perform at our SRI KARI Ayurveda clinic. First, patient should lie down on the table in supine position. Then his eyes are to be cleaned with cotton dipped in lukewarm water. After cleaning, round Pali with 2 inches height and a diameter of eye orbit is to be attached by pressing the bottom edge of the Pali as shown in this video. On both eyes, it should sit firm and stick to the orbit of the eye. A small piece of Pali is to be attached on nasal part to cross-link polys on both eyes. This will act as an additional support. A very small elongated shape of poly can be attached on lower border by pressing and attaching firmly with finger to enhance extra support and to prevent the leaks of the grita. Sarvatmana netra balaya yatnam kurvita nasyanjana tarpanadyehi drushtischa hina vividam jagatcha tamomayam jayati ekarupam. Ayurveda advises for a healthy person to put all efforts to conserve his vision and to avoid all sorts of vision ailments. For that, Ayurveda advises Nasya, Anjana, Tarpana. A person who follows Nasya, Anjana and Tarpana. Nasya is nasal administration, Anjana is an external application of the eye, and Tarpana is the procedure which we had discussed now. So all these procedures will bestow the vision, and a person who follows these 3 procedures will conserve his vision for his lifetime, and he can revert all sorts of forthcoming eye ailments. Sarvendriyanam Nayanam Pradhanam. It was explained that eye is the most important among the 5 sense organs, because a person who is devoid of vision, literally he will see the hell on the earth.